Hi, I'm Dr. Maria Papasadero, naturopathic doctor here in Brampton, and I've been practicing here for 15 years now. When I get an FST report back, then I want to obviously be able to explain it to my patient. So what I do is I basically turn it around and I say to the patient, anything that's come back as red or yellow, those are going to be the foods that you're going to take out. Anything that is green loves your body. Those are the foods that you're going to be able to eat. And so I basically go through each category at a time. So I stick with the dairy and eggs, and I will indicate to them which ones have become red, which ones are green. So I will say to this patient, for example, you will need to avoid egg whites, you'll need to avoid egg yolk, and of course all of the dairy items. So whether it's cow milk, goat milk, sheep milk, some of the enhanced panels also have buffalo milk. So it kind of just depends on the specifics of it. And then of course, casein, you'll have to avoid cheese. And this is where I'll go through some of my options that I do carry at the clinic. So, through my years of trying a lot of these foods myself, I keep a lot of the packaging. And so in the clinic room, I have examples of dairy-free yogurt, whether it's made from oat milk or almond milk, or whether it's coconut milk. I will show them examples, and patients love it because now they can just take pictures of those items, go to the store and have it accessible to them, and they're like, oh, that's what Maria told me about. And so then I go to the next category. So we deal with grains. We go through all the gluten-containing grains. So if they hit gluten, then now they're going to have to avoid gluten. And then of course some of the other items. So if it's barley, for example, the tricky thing about barley is that it's in a lot of things. You'll see it in barbecue sauces, you'll see it in multigrain breads, you'll also see it in beer. So it's really trying to identify for them too what that grain is also in, because it could be in multiple items. And then also going through the gluten-free grains. Now, the thing with gluten-free grains is that when a patient hits rice, it does become a little bit more difficult for that patient. So if they don't hit rice, it's great. You can give rice cakes, rice crackers, rice pastas, a lot of rice options. When they hit rice, unfortunately, it does isolate them. They will need to stick more to a buckwheat or millet or even quinoa type products. But you just explain the benefits behind that, and they will be quite compliant in doing so. And so I just tell my patients, anytime you would have rice, just do quinoa. It's a good substitute for that. And then you're going over fruits, veggies, and also with your fruits, you got to be careful because, for example, oranges, it's also orange juice. So you have to kind of be a little bit more specific because they don't realize, the extent of them. And even under vegetables, a lot of patients hit potato. And so that includes potato chips, which not all patients are very happy about, but it's making sure that it is clear in their mind. And then that's when I'll pull out the RMA FST handout book, which goes over all the specifics of each category. And so I'll open up the book, say this is a package you'll be able to take home with you, and we go through each category. And what's really nice about the category breakdown is because it goes through foods to avoid. So for example, under dairy, everybody forgets about butter, they forget about sour cream. These are items you have to go into specifics. And that's where I might pull out my Baicel vegan butter, let them know that there are options. The second category in the dairy section talks about the ingredients to avoid. So lactoglobulin, for example, the average person is not going to know that this is a milk protein. And so you have to just teach them that you need to look at some of these ingredients on the back of items. So for example, on a bag of sour cream and onion chips, most likely there's going to be a milk protein in there. And then of course the last section in that particular category are the foods that you need to change as your alternative. So under milk, you will see almond milk, cashew milk, coconut milk, all the different options. However, you do need to explain to your patient, if you hit almonds, well, you cannot do almond milk or almond yogurt. You will need to stick to either a rice milk or a coconut milk, whichever one they hit green on. And so I'll run that through each category, whether it's the gluten, the eggs, the yeast as well, and really identify those for them and then give them the package to take home. And most patients are pretty compliant in them, and some patients even surprise me when they're almost at tears with trying to really trying to reduce some of those foods. But I would say 90% of my patients are great at really trying to avoid them. And after a month, they're already 60% better, and I really haven't done much. It's just them avoiding the foods. We have to remember that when it comes to an IgG reaction, this is a delayed response. So it can take up to 3 days potentially to kind of see a reaction. So if you ate an egg this morning, you could have symptoms tonight, tomorrow, even after tomorrow. So if you ate an egg twice in a week, you could have symptoms every single day. And so when I get that food test result in and I see a lot of reds, let's say at the end of the day, maybe there's 25 red food items. we need to identify which is the top 5 that will always probably be an issue for them. Because if potato comes up, for example, which can be a common reaction to many patients, it could be an issue of overconsumption. So obviously they might be consuming it way too many times out of the week, but that is still a problem. We still need to address that inflammation that is coming from that potato. So I still will get that patient to avoid it. So when it comes to the treatment plan of avoiding foods, when we get that result in, I always focus on 1 month, because if you tell a patient it's going to be a 6-month journey, you've already lost them. Okay, so it has to be 1 month. So I will tell them that in 1 month we will touch base in a quick 15-minute appointment and figure out how much you've improved and what might need to change in the treatment plan. By then, they're already feeling much, much better and they're thanking you. And then after that, that's when I propose the idea that this is going to need to happen for another 8 more weeks. So I want to try to get a total of 3 months. And so at that point, I say, you know what, you need a little bit more time. I want to get things a little bit more healed up, and I want you feeling good for longer than a month. So let's avoid it for another 8 more weeks. And so they're like, okay, no problem, I will do that. And then at the end of the 3 months, that's when we talk about reintroducing foods back. So the way that I will proceed with that is I will start with the lowest yellow food, and we'll start one at a time. And it's very important to explain the process of reintroducing, because then things get clouded again. So when you start with one food item, you only want to do that one item on that one day. So you'll have a little bit of, let's say, eggs and breakfast. If you're feeling great by dinner time, you will add a little bit more eggs at dinner, but that's it. You are waiting and watching for 2 additional days. So if by the next day you have diarrhea, constipation, you feel horrible, you're gassy or bloating, you know that food item has to stay out for a little bit longer. If you clear all 3 days and the patient is feeling great, that's a food item they can bring back in now. But again, it's not it's not like a full-time egg consumption. You still want it in moderation, so that way the sensitivity doesn't build back up. So at the end of the day, we want to identify those last 5 items that no matter when they eat it, they're going to react. Those are the true IgG reactions that you're trying to identify for your patient.